Ew. See, they're already live.
Check 1, 2. Check.
Yeah, it works. Perfect.
Which way do you want to sit?
I don't care.
Last.
I don't know.
Here? You want to go left?
Of course, it doesn't
From
matter.
there, left to right is that way.
I know, that's why I thought it was going to be
I
the
don't
other
care.
way.
All right, let's do it this way.
I don't care.
So it's there, left or right, not
Okay.
us.
I'm good with that.
Won't go a little OCD.
Sabrina's like,
on
I'm in
us.
the middle regardless.
Yes, I do. Ugh.
He's on the floor.
I guess we share this one.
I was going to say, hey, Bob, I have all on board over here, but
I hate microphones.
no.
I hate sitting and I hate microphones.
Go ahead, no, this is.
I would rather stand down there.
Waterfall on. It's nice. It's bad that you have to write it down.
I didn't run any of this
No, but
information,
they're
but I scoured all
getting
the
credits for coming, so that's why you get people doing
Well, hopefully it's accurate.
it. And it may just save their life.
Good evening. Welcome tonight to our panel presentation on the opioid overview. I'm John Geddes, and I'm glad to have our panelists here tonight, and glad each of you could make it. Some of you have to be here, I understand, but we're happy to have all of you. This event is organized by the John C. West Forum on Politics and Policy at Winthrop University. It's underwritten by Morton & Geddes and Robinson Bradshaw law firms, and it's our pleasure to bring to you tonight the moderator, Dr. Marin Pierce, Associate Professor at Winthrop University, who earned her master's degree at UNC Greensboro and PhD in counselor education from the University of Tennessee. She teaches courses in crisis and trauma counseling, addictions counseling, and other graduate level counseling courses. There are note cards. If you'd like to write a question down and hand it in or hand it up, someone will come get it. We hope you'll find this to be a conversation that brings some hopefully some comfort to you about the work that's being undertaken and the work that people recognize, and maybe some ideas to where you can make your communities and this community a safer place. So with that, I'll turn it over to our moderator. Thank you.
Thank you. Welcome, everyone. We are excited that you are here and look forward to an engaging discussion. I'm Marin Pierce. I will be moderating the discussion tonight. And just a few notes about logistics. When we move to question and answer time for our panelists, we'll be doing that in two ways. You'll have the option to raise your hand and verbally ask questions, but due to the sensitive nature of our topic tonight, we are going to have the option to use note cards. So we encourage you to grab a note card, or you can raise your hand and a note card will be given to you, and that way you can ask your questions anonymously if you would like. So know that that is an option available if you choose. We have 4 panelists tonight, and I will introduce them in order from your left to right. Janet Martini is the Executive Director for a little bit longer, we hear, at Keystone Substance Abuse Center here in town. She received her Master of Education in Counseling from Clemson University and is a South Carolina Certified Addictions Counselor, a licensed professional counselor with supervisor designation in South Carolina, and a National Certified Counselor. Sabrina Gast is currently serving as the York County Coroner. She's a registered nurse and received her Master of Science in Nursing from Duquesne University. In addition, she is a fellow of the American Board of Medico-Legal Death Investigators. Sheila Quinn is the former Deputy Director. Is that still former?
Well, it's current still.
It's current still, okay. It's in process of changing. Deputy State Superintendent for Innovation and Effectiveness at the South Carolina Department of Education, and as of July 1st, she will be full-time as the District Superintendent for Clover Schools. She received her Doctorate of Education from Gardner-Webb University. And finally, Danielle Center is the Prevention Director for Keystone Substance Abuse Center here in town, and she received her Master's of Public Health from the University of South Carolina, and she's a Master Certified Health Education Specialist. So please join me in welcoming all of them to our panel tonight. So thank you all, and we will begin with Ms. Martini.
Very good. I'm also a Winthrop alum. I won't say what year. 1989. Well, thank y'all very much for being here tonight. The topic, I know, our mayor said, hopefully shed some hope. I'm gonna scare you a little bit at first, and then we'll build up to that hope as well. So, and hopefully you can hear me. The presentation, I actually wanted to include some national statistics in this as well as South Carolina and York County, so we can see how we all fit into the big picture too. So hopefully my clicker, yes, it does work. Very good. Opioids. Some folks go, what in the world is that? And so I thought we'd start off with a definition of that, and of course it includes legally prescribed pain medications, and you see a list here, some that you probably recognize. Some of us have certainly been prescribed those, maybe our parents or grandparents, wisdom teeth, you know, those types of things. So those are probably familiar to you. The classification of opioids also includes the illegal drug heroin, and of course synthetic opioids such as the fentanyls, which of course Sabrina knows a lot more about fentanyl than I do. So that just gives you a basic overview of what we're talking about tonight. This slide, I know there's no way you can break down the minute details of this, so I'm just going to ask you, hopefully no one's here colorblind, and you can see the differences from 1999 to 2014, and of course 14 is the latest map that I had available, so I know that the numbers, the color of red and everything is going to get darker as we see more maps come about. But this is an overview of what we've been seeing as far as increases in drug overdose in our country for that span of time. It's largely driven where you see the blues. That means we had lower overdose death rates by drugs. But where you see in 2014 the reds and the oranges and all, that's largely been driven by prescription painkillers and heroin. So that just gives you a picture of where our country has been headed for the past 15 years. National and South Carolina statistics, a lot of you I'm sure already know this. In October, the White House declared a public health emergency, and in December, just before the holidays, our governor here in South Carolina also declared a public health emergency. I believe this presentation is also going to be made available to you via Facebook or some other means, and so I've also included some links here where you see things underlined that you could actually dig a little deeper than what we have time for tonight, and you could actually go in and look at the executive orders that Governor McMaster put into place as well. The reason why all the hoopla is focused on the opioid situation right now, of course, if you think about that map that we just looked at and think about what the CDC has been telling us as well. The reason for this is they're saying that in the United States, opioid prescriptions are written for too many days, and just too many prescriptions are written in general and at too high a dosage. And so, again, when you have time, you can certainly dig a little deeper into what these slides specifically say as well. But that's an overview for you. I've got two maps here, one for 2013 and the next one will be for 2015. But what you see here is states where they are getting more of the reddish and the orangey colors. That's where you're going to see more of the overdose deaths. Now here in South Carolina in 2013, you'll see the number of deaths at 620. At that time in 2013, South Carolina was in the lowest range in the country, second lowest range, in the country. In 2015, our numbers went from 620 to 761. So just in 2 years, that is a 23% increase. And so that to me is scary, even scarier when I see probably the dates and the maps coming out from 16 and 17. So I'm sorry, where that fear is coming from. It is scary. Again, at the national level, the CDC came out with 2016 numbers showing a little over 64,000 drug overdose deaths in our country in 2016. The exact number you see there, 64,070. That represents 175 deaths every single day, compared to 144 in 2015 and 129 in 2014. So that is a 36% increase in just 2 years. So I like to help folks put that into perspective. That is one death every 7 minutes. So just in our time here tonight, 9 people will have died in our country from drug overdose. And I usually go out and tell folks this as well. It helps bring it home too. 175 people. You can just imagine last time you went on a plane trip, and I'm not trying to scare you because I know you're going on vacation tomorrow. I just realized that. I'm sorry. But it just equates a commuter aircraft, about 175 people. So if you could imagine a commuter airplane crashing every single day and every person on that plane dying. That's the equivalent to what is happening here in our country. So that, for a lot of people, that puts it into perspective for them too. Again, the first time we're seeing numbers from the CDC, they're breaking down the mortality rates along geographic and racial lines. So the interesting thing about this, because a lot of folks think, and this will show up on the next slide, a lot of folks think that the opioid epidemic, drug overdose deaths specifically related to opioids, is a rural problem, it's a white person problem, but it is not, because what we're seeing is a steep rise among Black Americans, hitting hardest between that 45 and 64 age range, which I was like, wow, I did not realize that until, of course, I read this. And so what we're seeing in this map, again, I've got a link with the prior slide so you can dig a little bit deeper into that. It's fentanyl. Those of you have heard about fentanyl. And several years ago, we just didn't hear that much about it, but it has hit home and it is all over the place. And certainly you'll hear about that from Sabrina again. The thing about fentanyl, we know that it is much, much more potent. There are different types of fentanyl, carfentanil, those types of things as well. But the reason why we're seeing this more in urban areas as well is because now fentanyl is being laced within other drugs, marijuana, cocaine, methamphetamine, and those types of things. And many, many, many times it's without the knowledge of the person using what they think is marijuana or cocaine or methamphetamine. It's being laced, and people just don't know. And that's why we're seeing a large increase in the number of accidental overdoses versus suicide rates, which you'll see in just a couple of minutes. Again, some of the national statistics. For the first time in 50 years, life expectancy in the United States has dropped for the second consecutive year, and it's largely due to drug overdose deaths. And these now surpass heart disease as a leading cause of death for Americans under the age of 55. And you'll see here nationally about 1 in 5 high school seniors report misusing prescription drugs at least once in their lifetime. You'll see some more specific information, I know, when Dr. Quinn and Danielle speak about that specifically related to here at home, too. Again, at the national level, some of the things we want you to know is that the United States makes up 4.6% of our world's population, but consumes 81% of the world's supply of oxycodone. So what I get from that is our society today, unfortunately, we don't want to feel or experience any pain whatsoever. Pain became the 5th vital sign a lot of times when someone that you know or you've been in the hospital, and the goal is always to get that pain level down to 0. But what I know is, and what a lot of folks, I guess smarter folks than me, say, pain actually serves a purpose in life. Sometimes, and I'm not talking about the unbearable type of pain, I'm talking about just general day-to-day type pain or wisdom teeth or something like that, where really a prescription opioid may not be necessary. We're just trying to avoid pain at all costs. And the thing that is so scary is that 4 out of 5 heroin users started with just a prescription for pain. It could have been, again, for wisdom teeth, a sports injury, and so that's why it's so very, very important that we work with our children and our young adults, because I don't know about you, but I was probably a freshman in college when I had my wisdom teeth removed, and I sure came home, of course that was a long time ago, but I sure came home with a prescription. I didn't use it, but I sure came home with a prescription. And so that's part of our education with physicians and dentists and folks as well, because there are other options. In 2016, opioid deaths in South Carolina almost surpassed homicides and automobile deaths combined. And also in 2016 in South Carolina, there were more opioid prescriptions dispensed than the entire population of South Carolina. Unfortunately, also in that same year, 2016, York County was one of the top 10, and this is not a top 10 we want to be in, but we were in the top 10 as far as the highest number of overdose deaths in our state. And that's something that we're doing something about. So we are going to give you some hope. This next slide are numbers exactly from Sabrina's office. I'm not going to go over in depth, but I just kind of want to let you know that in just 3 years in York County, we've seen a 92% increase in opioid-related deaths just here in York County. So it is here at home. This next slide is probably blurry, or at least it looks blurry because I need my glasses more. This shows the current burden of opioid use and overdose in South Carolina with emergency department discharges. And so just in this slide, the darker the county, you're going to see higher numbers. And so in this, York County is in the second highest category in South Carolina. But what we know, and what we need to recognize, and what I tell folks at the state level, is that folks in border counties, a lot of folks seek health care in North Carolina. And so our numbers, even in this, are going to be underreported. And so I hope at some point we can start collecting data from other hospital systems that are neighbors. This next slide just gives you another overview of opioid-related deaths in South Carolina and its comparison to the number of murders in South Carolina. Again, York County is in the highest category in South Carolina for opioid-related overdoses. And this last slide, before I turn it over to Sabrina, gives you an overview of intent, drug overdose deaths by intent. And what this shows is that unintentional drug overdose deaths by far outweigh actual suicides. And so what this shows again is that the folks that were using did not intend to overdose and die. And so that's why we're trying to educate so many folks that you don't know what you're getting out on the street especially. So, and I will now actually turn it over to Sabrina. Thank you.
Okay. So I'm going to kind of bring it home to what we're seeing here locally in York County. We deal with all of the deaths in York County. So we see everything from homicides, suicides, accidental overdoses, traffic fatalities, and all of that. So I'm going to try to kind of bring it down so that you can kind of see where we've gone over the last few years. I've been in this office since 2006, and when I came in 2006, we had 0 heroin overdoses, 0. And that, unfortunately, is not the case any longer. So over the past few years, this chart just shows you kind of how our caseload is broken out. So there are 5 different manners of death across the country and internationally. So you have naturals, which is like your heart attacks, your strokes, accidents, which are accidental drug overdoses, traffic fatalities, fires. We have suicides with the intent of harming oneself. We have homicides where someone else takes the life of another. And then we have this category called unable to be determined. And that is kind of like a catch-all. If we can't figure out which one of the other 4 the manner of death needs to fit in, we can put it in the unable to be determined. We don't like to do that, and therefore we try to really not do that very often because it kind of leaves our families hanging. It doesn't give them a final answer. So we work really hard not to do that. So very few of our cases, especially related to drug overdoses, are actually listed in the unable to be determined category. So this chart shows you, so in 2014, we had a total of 129 accidental deaths. So that includes everything, traffic fatalities, overdoses, and whatnot. We had 28 overdoses, and those may be from Xanax, they may be from opioids. At that point in time, we weren't really identifying which type of category the overdose was in at that point in time. It wasn't until about 2016 that we really started looking at the numbers and the types of drugs that individuals were using when they died. So 2015 is when we started starting to collect some of that information. We had a total of 140 total accidental overdoses or accidental deaths. We had 38 overdoses by some sort of means, by some sort of drug, and then we also had 2 opioid overdoses. So that's your heroin, your fentanyls, morphine, something like that. 2016 is when we start to see that large jump, and that can be possibly because that's when we also started really identifying the types of drugs that were in people's system and listing those on the death certificates. We had a total of 166 accidental deaths. 49 of those were overdoses. 37 of that 49 were actually opioid overdoses. So we're starting to see a huge jump there. And then in 2017, we had a total of 152 accidental deaths. 50 of those were overdoses. 41 of those were actually opioid overdoses. So we're seeing, that's where we start to see those numbers kind of climb. In 2013, we started kind of keeping up with what those were. It wasn't until 2016 that DHEC, the Department of Health and Environmental Control, who actually, they are the holders of the death certificates in the state of South Carolina. That's where they get all of their mortality statistics, is from the death certificates. And that's when it started coming on everybody's radar that, hey, we don't know what type of drug these individuals are using. It would be nice if we were able to identify those specific drugs related to that. So that's when we started really kind of honing down on the types of drugs that were in the individual system and listing those actually on the death certificates of those individuals so that we could start collecting data on the different types of drugs that we were seeing. So just to kind of let you know what we had here, that's just kind of what we just went over, and the opioid overdoses versus the actual total overdoses. We see a large disparity here in York County as far as males. Most of the individuals that die from drug overdoses are male, 27 of those compared to 18. Race, for us, most of them are non-Hispanic white males. We've had a few Black Americans that we have identified as opioid-related overdoses. Our age disparity, most people think that we're focusing on teenagers. What we are finding actually here in York County is we're seeing the early 20s up to the 50s, 60s. I think our oldest overdose at this point was like 78. And just for a little history and background on her, she was a chronic pain patient, and she was used to getting her oxycodone, and her physician wouldn't give her the prescription any longer, so she had no other choice but to try to go to the streets to get something to help ease her pain, and what she bought was a fake oxycodone. And a fake oxycodone, to somebody that doesn't know what they're buying, looks just like the prescription drug. So you've got dealers out there that are taking the drugs, breaking them down, adding the fentanyl or adding heroin to those drugs, repressing them, and then selling them for the oxycodone on the streets. And unfortunately, that's what happened to this lady. So we actually started breaking down the type of opioids that we were seeing. We had not seen any fentanyl overdoses until about 2015. We were starting to see heroines kind of creeping back into the scene at about 2012, 2014. But you can see the pink there in 2015 is when we started actually seeing the fentanyl come on the scene. So we had, there are some smart people out there concocting these drugs. So we not only have a drug called fentanyl, but we also have what they're calling a phenylog. So the chemists are there, they're redesigning these drugs, they're making them more potent, they're making them stronger, and they're putting them into the environments where the drug dealers are mixing those drugs. And when they take that parent drug of fentanyl and they make it, or they alter that form, that's called a phenylog. That's how we identify those in our tox screen. So if you've heard about gray death, the carfentanyls, we've had methylphenol fentanyls, we've had all kinds of different types of fentanyl. They're even stronger than the parent drug of fentanyl. So you're talking fentanyl is 100 times stronger than morphine. You're talking phenylogs can be up to 1,000 times, 10,000 times stronger than the fentanyl. So we have individuals that are taking these medicines and they're dying before they've even really ingested the medication or ingested the drug. 2016, we actually had 17 fentanyl overdoses and no phenylogs. 2017 is when we started seeing the phenylogs come onto our scene here in York County. We had 15 fentanyls and 9 phenylogs, so we went from 0 to 9 in 1 year using those synthetic phenylogs. And this just kind of shows how quickly that jumped up for you here. We are seeing drugs called, again, we don't want to be in the top 10, but York County has been identified as one of the counties where we're starting to see some of these synthetic phenylogs pop up that they haven't seen anywhere else in South Carolina. We've had several of those come in on our toxes in the last couple of months where they're not seen anywhere in South Carolina. They're coming from other states, so they're being shipped in from Mexico, Texas, Florida, all of those areas as well. Naloxone is the only antidote that we have for opioids, and it is used by EMS personnel and paramedics where they go to a call where they have an individual that they believe has taken a drug overdose or has ingested too many drugs. They can use this naloxone to try to bring them back to help it negates those receptors so that they can start breathing again. We don't have any data from, this is actually data from Piedmont Medical Center in the EMS units. There was no specific data for 2016 when I talked to them, but in 2017, EMS, so your ambulances on the road, gave 240 doses of Narcan or naloxone for 2017. And that doesn't mean that that's 240 patients specifically, because some of these patients are requiring multiple doses of the Narcan to get them to safety into the emergency departments. And then the emergency department themselves actually administered 177 doses just for 2017. You also have to remember, like Janet said a minute ago, a lot of these patients don't go to our Piedmont Medical Center. They may go to a Charlotte hospital, and we don't have those numbers. So we anticipate those numbers to be much higher than what we're getting reported to us. Storage is an issue for us, just to kind of let you see. This is our prescription drug room in our office. This is behind 2 locked doors in our office. Every drug that we collect at a drug scene has to come back with us. It is counted, it is inventoried, and it is kept until that investigation is completed. We have actually had to start keeping Narcan in our office because my investigators are handling these drugs, they're counting these drugs, and I don't want my staff to inadvertently come into contact with one of these drugs that can kill them. So we're having to keep those drugs in our office now. Couple of challenges that we're seeing. Cost for toxicology testing is very, very expensive. We can't keep up with the chemists out there that are recreating these drugs and making them more strong. We can send blood work off during these investigations to our state lab, but our state lab can't keep up. So state lab is free, private lab costs money, but private lab can tell me what's in that toxicology, and that's what we're going for. So it is costing taxpayers a lot of money to investigate these deaths, to figure out what those drugs are and what those chemical makeup is in the decedent's system. We are seeing more and more cases of where, usually it used to be we would go into a scene where we think there's a drug overdose, and we'd find needles and syringes and spoons and paraphernalia there. We're not seeing that very often anymore. We're going into scenes where there's nothing there because it only takes a pill. It doesn't take much. They don't have a stash of those medicines or those drugs anymore. So we're not finding those types of articles on those death scenes. So it can be a little difficult for us. And then we're actually having to work with law enforcement a lot closer and helping them collect things at those scenes. Cell phones are very important for us when we're doing a death investigation because maybe we can track back to who sold the drugs to that individual. So we're going to be collecting those at the scene as well as interviewing everybody else involved at that scene. We're friends and family. So, if you have individuals, a friend that is unfortunately has died from a drug overdose, it's very likely that you're going to get a call from law enforcement or from our office. We're going to be asking questions, do you know where they got it from, so that we can help track that down. So we're working a lot closer with the DEU and law enforcement and trying to help kind of narrow down where these individuals are getting these drugs from.
Good evening. It's nice to be home. It's nice to be at my alma mater. I do remember doing cultural events. I don't even know if they still call it that. So it's nice to see so many students in the audience. I'm Sheila Quinn. I'm the superintendent-elect for Clover School District. I'm going to be sharing with you today some of the data from our district, but I want to give you some perspective about our size compared to some of the other York County school districts. So we have a little less than 8,000 students in Clover, and the data will reflect some smaller numbers. Remember, Rock Hill is 3 times our size, so you can, at best, triple the numbers that you see from ours, and Fort Mill's twice our size, and York's a little smaller, so they may have similar numbers or a little bit smaller numbers. So I'm going to talk a little bit about numbers, but what I really want to talk to you about is what we hear our students say and what our students have learned and our parents have learned through some of the things that we have been trying to do to educate our students, because this is what we know. Message to students matters, and it matters when you tell them. I'll give you a personal example. My daughter and son went to Richmond Drive here when they were young, and a friend of theirs illegally copied a movie. It was Shrek at the time, Shrek 2 or 3, I can't remember which Shrek. And they were horrified because they had just had this presentation at school about safe media use and how you're not supposed to do that, and they were just they wouldn't even watch the movie because the person illegally copied it, and they thought that was terrible. 2 years after that, in about 6th or 7th grade, they were like, oh, that wasn't a big deal. By 9th grade, they were saying, how do I do that? How do I make that copy? And so my point in telling you is the younger that we can talk to students and the more that we can make it real, the better chance we have of maybe preventing some of the behavior down the road. So I want to talk to you about, so what do we know from our students about opioid use? And there are 3 key data points: our discipline data that we track through Power School, our athletic drug testing data, because in Clover we do drug test our athletes, and our student perception data from our all-on-board survey, which we just did again last year. And I'll try not to go into that too much because I know my partner over here is going to go into that as well. We didn't talk before we put our slides together. So from our discipline data, I honestly was shocked at this. I've been away from Clover. I work at the State Department of Education now, and I'm coming home to Clover to be superintendent soon. And when I was assistant superintendent, these numbers were a little higher, a good bit higher, in fact. So I'm actually excited that these numbers are where they are. But we've had about 35-ish drug cases this year. I did not pull our middle school data. I should have, because that would be a more reflection of our numbers in Clover as a whole. These are our high school numbers. 15 of those incidents were under the influence. That means the student came to school high or got high at school. 10 incidents were possession, so they weren't under the influence, but they had it on their person. With prescription, and that was with marijuana. Prescription drugs, we've had 6 cases, 4 under the influence and 2 possession. Again, I called the principal at the 9th grade academy and our high school and said, these numbers look low. Are you sure they're accurate? And they said, you know, this year we've had much lower numbers, which actually does give me some hope that some of the preventative things we're doing are finally coming home to roost. In our athletic drug testing, from 2015 to the present, we've had 22 positive outcomes from our athletic drug testing, and good news, no repeat offenders. So parents in the room, this is what happens when we do our drug testing. All students in the season that they play, at the beginning of the season that they play, or somewhere near the beginning, they don't know when, they get pulled up in the afternoon from their practice and they have to take a drug test. And the results come back fairly quickly. And the only person in the school district who knows the results of the drug test, in the case when I was assistant superintendent, that was me. I was the only person who got those results. Our response was to call parents, to ask the parents to come in and sit down and have a conversation with us and go over the results of the test. Most of the time, parents were very, very willing to come in and were horrified and upset and worried, what can I do? And we could immediately hook them up with resources at Keystone, and that has been very successful. We don't discipline students. We don't tell the coach. We don't remove them from the team. It is literally for a preventative standpoint. If they're then, at that point, though, they enter a smaller pool for random testing again, so they could be pulled again during their season. If they're called a second time, then we do have the penalty of letting the coach know, and they are disciplined for that. Most of our coaches are going to remove you from the team if you have a drug offense. So our athletes have learned that we take it very seriously, and that has had a positive effect, I think, on some of our numbers. You can see the majority of the positive cases were marijuana. We did have 3 opioids or opiate-related positive tests. On all 3 of those, when we called the parent and asked the parent to come in and have a conversation, it was a prescription the child had been prescribed for something. So we just, again, caution the parent, make sure they take it appropriately, and if they don't take it, I'll get rid of it. There were 2 other cases and then 2 invalids, and the invalids happen when there's something called a cold sample, and that is when something amiss happens in the drug test, and it could be that they brought in a cold sample, or it could be they tried to mix it with the toilet water. I mean, all kinds of things happen. So in that particular case, we treat it like a positive because we err on the side of caution. Remember, it's not punitive, it's to help students, so we talk to parents about why would there be a cold sample here, that kind of thing. What I need to tell you is not all parents follow through and try to treat this as something they need to take seriously and get help. Sometimes it becomes, I'm going to punish you, I'm going to take your car away, and all those kinds of things, and certainly that's a deterrent, but what we really encourage our parents to do is to take more progressive action and really begin a strong counseling program with students, because information matters. Talking to kids really does matter. We do a survey every 3 years, right?
2 years.
Every 2 years, excuse me. Every 2 years, we do a survey with 7th, 9th, and 11th graders, and the questions that we ask those students focus on usage, perceptions of harm, do you feel like this is a danger to you? And then the influence of peers and parents. Who matters to you? Who do you listen to? And just very quickly, just some key things, because again, I don't want to steal Danielle's thunder here. You can see the question, have you used in the past 30 days? And across all of the substances, the report of substances is down except for e-cigs. And I'm going to tell you, vaping is the next big crazy dilemma that we've got to deal with. Our kids are not only vaping after school, they're vaping on the bus, they're vaping in class. They inhale and then they blow it out this way, and they're able to vape right in the classroom sometimes. So we've had to increase our monitoring of bathrooms, stairwells, all those kinds of places, because vaping is becoming so prevalent. I've highlighted in red use in the last 30 days for prescription drugs, and you can see 4.32%. And again, this is all 4 school districts. This isn't just Clover. The second question, how much do you think people risk harming themselves if they use a substance? You can see the perception that there's no risk in using a substance is up for e-cigs, for marijuana, and for prescription drugs. In other words, they don't perceive it to be a big deal. They don't perceive it's going to hurt them. And that is the scariest bit of information. Because if there's not a healthy fear and not an understanding of what the drugs can do, then we're going to see this trend go the wrong way. How wrong do your parents feel it would be for you to use? You can see they don't feel like it would be too wrong to use e-cigs. The perception that the parents wouldn't approve is up for e-cigs and for marijuana. That parents would be more accepting, let me say it that way, for e-cigs and marijuana. And then how wrong do you think your peers would see it? And again, the perception that peers will not see it as wrong is up for e-cigs and for marijuana. So what has York County done to really begin to work with students and to work with parents about specifically the opioid issue? Most of you know we have really been active with Operation Medicine Drop, and I cannot tell the parents in the room enough, and many times, please check your medicine cabinets, please clean it out regularly, check grandparents' medicine cabinets. When you talk to middle schoolers, they're more apt to use a prescription drug because they have access to those in their home and their grandparents' home. And so that is a real issue you've got to be vigilant about, is getting those medicine cabinets cleaned out. We do what's called RAP sessions across all 4 school districts, and that's raising awareness of parents, and those have been, depending on the topic, we could have a huge crowd or a small crowd. This topic generally brings the larger crowds. When we've done the blunt truth that usually about marijuana use, that has usually brought bigger crowds. But we need to do more of that, and we need our parents to be more active in those. And then this year, I wasn't here, but I know there was a York County Opioid Summit, and you may be talking about that some, Danielle, so I won't spend a lot of time there. What have we learned? What have we learned from all of the different things that have been sponsored through all of our partners here? And we've learned that education matters. How young you talk to kids matters. So we've got some strategies I'll talk to you that we're using with our middle school and high schools. My suggestion will be, when I get back to Clover, will be, what are we doing in our elementary schools? And I know you have to be sensitive about how you say things to young children. But again, getting the message to sink in early seems to matter more. We know that the proliferation of the opioid and heroin use in our county is on the uptick, and it's bigger than we think, and probably bigger than we know. We border Gaston County and Charlotte Meck, so our families go both directions, so we really don't have a good idea. In fact, probably more of our families on the Lake Wiley side of town go to those 2 places than they do come to Piedmont. So we really don't have good numbers in Clover. We also know that legislators, law enforcement, doctors, and pharmacies can implement protocols that can reduce the risks. And as you know, legislation was passed this year. We have mandatory lessons now about opioid use. Our health standards have been revised. If you go on the State Department webpage now, you'll see a bank of resources that teachers have to teach about it. Health is required K through 8 and one time in high school. So it's usually taught by PE teachers. And so there's right now a round of training going on across our state on how to teach about the opioid issue. What is Clover School District doing specifically with students and parents? We know our numbers are down, so that's good. Don't always know if that's accurate, because it's harder to catch kids with pills than it is with marijuana. It's just harder. Sometimes they have them for, they're supposed to have them. They're on medication. And so when they're abusing those, it's harder to detect. But what we're trying to do, again, is focus on our health curriculum and making sure that we're teaching. One of the units that's in every state curriculum guide for every school district is alcohol, tobacco, and other drugs. And that is a required unit for students to take every year until one time in high school when they finish. Through Keystone, we've augmented our health course further for 6th grade students, and we're teaching the life skills curriculum there. Again, trying to get to those students at the beginning of middle school when they're still very formative in their thinking. We've increased our RAID inspection. That's the drug dog. We have the drug dog about 12 to 16 times per year in Clover. A lot of times they'll hit on book bags, they'll hit on the cars. Our 9th grade campus, we take them throughout the building, and it's pretty successful. We end up finding a lot on a RAID day. On a RAID day, we do a lot of discipline work. I'm sure that that's true in other places as well, and maybe other places it's even busier on RAID day. We have a committee of students at the high school called the No Wrong Door Student Advisory Group, and this is kind of the principal's group of students who tell the principal, this is what's really happening. You know, these are the kinds of parties that are going on, or this is the kind of drug we're seeing. If they're buying pills in our district, the pills we're seeing the most are Xanax. And we know that because our students tell us that through this No Wrong Door Advisory Group. We also are hosting speakers whenever we can. Matt Balance talked about a better high to our 7th grade students. Again, I wasn't there this year. I didn't get a chance to hear that, so I can't share what the message was, but that is one strategy we've used. We are starting to do a lot more training with our principals, our counselors, and our teachers, and I'm going to tell you why that's extremely important. About 3 weeks ago in a media science class, a student came in, the teacher looked at her, she didn't look like herself. He tried to talk to her, she was pretty non-responsive, just wouldn't say anything. Started teaching, looked at her again, just didn't feel comfortable about it. Decided to go next door to the health science teacher, which is a trained certified nurse. She came over, took one look at her eyes, knew immediately that the student was in distress. She started seizing 2 minutes later. We immediately got her on an ambulance, got her to the hospital, and it saved her life. She would not have lived through that incident. So that would have been an accidental death. And it was because the teacher said something doesn't look right. And the health science nurse who was trained knew exactly what to look for. So we need more training for our teachers so that they can recognize situations like that and act quickly. We are offering recertification credit now to our teachers to go through that training. So that's an incentive for our teachers to learn some more on that. And that's my topic.
All right, so some of my points have already been covered, but I guess that's the benefits of going last and not coordinating all your presentations. But so just bear with me a little bit here. I'm going to kind of focus, I'm the prevention director at Keystone, so we work a lot with youth and kind of give you some strategies of how you can kind of prevent some of this stuff. And she kind of mentioned the life skills program, so I'm going to talk about that because that's like a big initiative that we're doing with all 4 school districts. So I also have data, guys. So just kind of, this is just youth and prescription pills. So this data isn't specific to opioids. So Sheila Quinn just kind of talked about some of the other pills that she's seeing with some of the students there. So this is kind of all inclusive of that. But the rate of substance use for those 12 to 17 is 4.3% or 1 in 23. So I know 4.3% sounds small, but if you look at 1 in 23, that's about 1 person per every classroom in a typical school. And that kind of makes you a little bit more cautious of how big this problem is. 1 in 10 teens say that they've used prescription drugs to get high, and then 1 child every 8 minutes is going to the ER for medication poisoning. So this is, she kind of mentioned the data from York County All on Board that they do every 2 years. So this is actually just kind of looking at this past year, 2017. And again, this isn't just specific to opioids. This is all prescription pills. And so I broke mine out by 7th, 9th, and 11th graders, so you can kind of see the difference there. And again, it's a very small amount. And remember, this is self-report, so the number probably is actually higher than it's showing up here. But I highlighted what's really concerning in red. So if you look at perception of harm, we know that if people perceive that there's no harm or no risk to substances, that they're more likely to use it. Well, the fact that 7th and 9th graders see no risk or slight risk those numbers are higher than 11th graders. So we saw that trend actually across all substances. 11th grade actually was trending in the right direction for most of the things up there, but 7th and 9th graders were trending in the wrong direction. So that's kind of concerning, and that kind of emphasizes why we need that early prevention. And again, peer disapproval. If your friends are more likely to think that it's not a problem, kids are more likely to do it. Now, nationally, in terms of opioids, they're actually seeing also a decrease with youth using opioids, and they're also, part of that reason is that they're actually reporting that they're harder to access right now. So that's a positive in our direction. So we are taking measures that are working. It's just we still have a lot of work to do. I know Janet mentioned kind of what an opioid is, so I just kind of I started off with prescription pills, so just kind of want to bring you back to the opioids. So I kind of listed the ones that we hear about most often, especially from our youth. I know there's a lot more that she listed earlier, but just so you know, obviously an opioid is a pill basically prescribed for pain. Okay, so I'm going to talk about this slide in a little more detail. So where do our kids get our pills from? Let me first ask a question to all of you. How many of you in your dorm, apartment, house, or whatever have prescription pills? How many of you right now have a prescription pill in your place? Okay, keep your hands up. Keep them up high. How many of you lock them up? Okay, so we have about 3 people left in the room, okay? So we talked there, people are getting, I put parents and grandparents' medicine cabinet, and it's even more to the point that they are getting them from their friends' medicine cabinet, everything. And part of the reason is that we don't lock it up, okay? For those of you that don't lock it up, how many of you count every single pill that you have under there? And the answer, well, we got one person that knows probably every pill. And that's the point I'm trying to make, is that it is just as easy as somebody's taking 2 pills out of one of your prescriptions and accidentally overdosing on that, because we all know, first off, we react to prescriptions differently. Okay, and then we know how dangerous these pills are now that are out there, and so this is what's causing part of the problem. And I've done this presentation to parents, and parents are telling me that they will even host parties, and the parents, adults, are going into the bathroom and stealing their pills. Okay, so it isn't just youth stealing pills, it's adults as well. And so it is very important to lock up your medicine cabinet and know what's in there. And if you're not locking it, maybe put it in another place, count everything, but you're going to have to be counting it daily, especially if you have a teenager around. The friends and peer piece, we all know that obviously for youth, if your friends are doing something, you're probably doing it as well. But the part that I want to kind of emphasize here that a lot of people don't know is in a school, if your friend basically hands you a prescription pill that's theirs, right there is a distribution charge. And most times people don't realize that, well, my friend just had this kind of ailment, I've already been prescribed something, they didn't want to go to the doctor, so they gave them that pill. That right there is a distribution charge. Them holding that pill is a possession charge for them. And that's how serious this issue is. Kids in school districts are getting charged with these things because they're just thinking nothing of it and just allowing their friend to take one of these. It's also even illegal for you to take your parents, your brother, your sister, all of those. And people just don't think about that, because I know sometimes my mom said, oh, I have leftover prescription, do you need it for this? And you think nothing about it. But that is part of the problem, is sharing prescription pills. The other thing with friends and peers, a trend that we're seeing now, which has actually been around for a while, but it's called Skittles Party. How many of you know what a Skittles Party is? We got a lot of college kids in here, so. Okay, so there are a lot more people, that's actually probably the most I've ever seen know what a Skittles Party is. Skittles Party is basically a party where people bring random pills, it doesn't matter what pill, blue pill, white pill, red pill, you put it in a in a bowl, and then you pass the bowl around and everybody takes a pill out of it. Okay, so that's part of the danger there, because first off, we know if you're having a party, there's also alcohol involved, which I'll show you the consequences of opioids and alcohol, but that's what's happening. Is people are taking pills not knowing what they are, their body's reacting the wrong way, and who knows, now that they're mixing all these pills and crushing them, making them look like an Oxycontin when it's really a fentanyl pill. And so those could lead to accidental deaths. So that's another trend that we're seeing with friends. Some people already insinuated with the wisdom teeth surgeries, and I will say the culture, I think with dentists is starting to change, where not as many dentists are prescribing opioids after a wisdom tooth surgery, but what's happening is typically, and I got mine out 1.5 years ago, 2 years ago, and I was prescribed 21 hydrocodone. Okay, I took 6 of them. So that means I have all those leftover pills. Well, anybody that's actually abusing opioids is going to know that there's going to be leftover pills. We've heard stories of kids approaching other kids in schools asking them for leftover pills, willing to pay for their leftover pills. And so they don't really think anything of it. So that is really where some kids are getting it, and I can tell you that they say wisdom teeth surgery is the first time anyone is typically exposed to an opioid as well. And there is evidence that depending on your genetics and biology and things like that, that it could take only 1 to 2 pills for you to become addicted to opioids. And then same thing with sports injuries. There was a case, I think 3-4 years ago, we learned about through All on Board that a student was prescribed opioids, came to school on crutches. Somebody approached them, didn't even know them, and asked for their pills as well. So kids know when you're prescribed opioids, and if you're really seeking them, they're going to kind of seek that out and try to get them. So mixing opioids with alcohol, and again, this is where it's really dangerous, especially with Skittles Party, but basically an opioid and alcohol is going to probably lead almost to death, because it basically slows everything down in your body. And it could take 1 pill and 1 drink. That's how simple it could be. So it's very important to know that there's a reason those bottles say do not mix with alcohol. And it's because it can lead to that, and obviously some people it'll lead to it faster than others. So safety guidelines. So the first thing is follow your doctor's orders. If the doctor puts on there to take 2 pills every 4 hours and you think you should take 4 pills every 4 hours, you are misusing opioids. Okay? In that situation, we always tell you to go back to the doctor, seek additional advice, because you don't know if taking those extra 2 can lead to some other consequence. And so make sure you're following what the doctor is telling you. We talked about locking your medicine cabinet. Can't stress that one enough. She mentioned Operation Medicine Drop, which these are actually all the locations. You actually have one here on Winthrop campus. So if you have any extra pills that are just kind of laying around your house, take them to the Winthrop Police Department, dispose of them. It's completely anonymous. The box is in the lobby, and that's a safe way to get rid of the pills. They also are now coming out with those bags that can disintegrate the pills as well, and I think you can get them at your local CVS and things like that. So there are proper ways. Don't flush them down the toilet. That contaminates our water system, in case you didn't know. So make sure you're just getting rid of them the proper way, and it's not just because of the water contamination. It's just to get them out, keeping them out of the hands of people that shouldn't be getting them. All right, so opioids and heroin, which some of the statistics was kind of shared earlier, but 75% of heroin users did get started with prescription opioids, and sometimes it's as simple as that 78-year-old that she kind of mentioned earlier. They were on opioids for a long time, taken off of it, and then they had to go seek it elsewhere. Other times it's because if they end up having to buy opioids off the street, they're actually more expensive than heroin, which is kind of hard to think about. So heroin is cheaper and it's easier to access, which is why most times we see that kind of transition there. So they talked a lot about fentanyl, so I'm not going to spend a long time on this, but fentanyl is 50 to 100 times more powerful than morphine. It is a prescription, but oftentimes it's given after like all the other opioids don't really work. But the ones that are on the street are not prescription fentanyls. They're being imported from China and I think Mexico. But what I did want you to focus on is that picture, because that picture shows you the fatal dose of heroin, the fatal dose of fentanyl, and the fatal dose of carfentanil. And if you can look at that picture, you can't even tell there's anything in those other 2 containers, because that's how much it takes to actually kill somebody. And so if you think about the heroin being cut with some fentanyl in there, it's not going to take much for that fatal dose to actually be in there. And as you saw from Sabrina's data, that there's already these fentanyl logs, I think is what they were calling them. But carfentanil is one of them as well, and that's supposed to be a tranquilizer for an elephant. That just shows you how powerful it is. And then they did mention how dangerous it was even to touch it. So even law enforcement is putting themselves in danger if they're coming across some of this stuff, because if they put it in contact with their skin, they can actually die as well. So that just kind of shows you how powerful this is. So these are some signs to look for. So this just kind of shows you, and I'm not going to read all of these to you, but basically, if you see any behavior change, this could be with friends, family members, your daughter, son, if you see behavior change where they really start isolating themselves, they start changing their friends, they start sleeping all day, those are kind of things that you would start to kind of notice first. We had some parents kind of talk to us about anytime they're starting to pawn things, asking for money. Those are also key signs that they are also involved in substance use. And then obviously kind of losing weight, the red eyes, that would be signs obviously if they had just used. So just so you know that there are key signs that you can kind of pay attention to and notice. So even you can save somebody's life if it's just like having that conversation with them. And then the solution obviously is prevention. So the key is early prevention. We can't stress enough that we just did a focus group the other week with 6th, 7th, and 8th graders from Dutchman Creek Middle School. And we asked them all kind of the substance trends that they were seeing, and the difference between 6th and 8th grade was unbelievable. 6th grade kind of only knew about e-cigarettes and juuling, and then we had 8th graders telling us that they knew kids that were mixing Oxycontin in water bottles. So it is important to reach kids at a young age. We target our prevention and our evidence-based curriculum with 6th grade students because that's kind of that transitional year. They're still kind of the babies of the school, and so they're not like thinking they're all that. And so that's kind of the age that we're targeting. And we also know that the age of first use for kids in South Carolina is now actually the age of 12. And so that number keeps decreasing. And so we're trying to get in and get this prevention earlier. And so what we are teaching is BOTVIN life skills curriculum, and this just kind of shows you what the curriculum looks like. It's not just I don't know how many of you are DARE kids in here, but I was a DARE kid where you just say no, and the only thing I remember is I got a t-shirt. So but this is not just about the substances and the consequences of it. It is teaching people the life skills that they need to be able to kind of say no. We also know that it's not just peer pressure anymore. A lot of youth are starting because they're coping with things. They're coping with depression. They're coping with anxiety, and they don't know what else to do. And so this is trying to teach them kind of how to deal with those things in the right way. So we are looking to do this. Our goal is to do this in every 6th grade. With every 6th grade student in all 4 school districts. And so this past year we were able to do it with 3 school districts, York, Clover, and Rock Hill, and then Fort Mill we did it in 9th grade. So it is something that we're working on and we're looking to build. With the opioid epidemic, BOTVIN just came out with this curriculum as well. Schools actually can still purchase this, but we're trying to add this as part of our curriculum too. It is a prescription drug abuse prevention module, and it's only like a 45-minute session, so it would just be like adding one additional class, but it is kind of to target the opioid epidemic. And so how do we implement this? We kind of leave it up to the schools. We know that schools obviously have a lot of things going on. They don't have a lot of time, but it is about 15 to 18 lessons, and each lesson is about 45 minutes. Now, we do kind of flex it a little bit depending on how schools implement it, but we've taught it in gym classes, we've taught it in health classes, we've taught it in homeroom classes. We're very, very flexible because we think that this is extremely important. And so we're trying to get this, like I said, in every 6th grade classroom across York County, and we're getting closer and closer. It says taught by Keystone employee. We have learned actually from some teachers that it's they receive the message better when somebody outside of the classroom comes in and teaches it, which is why we continue to try to do that right now. And then partnerships, obviously want to thank all 4 school districts for really working with us. We obviously need some more funding to be able to reach every 6th grader. United Way was able to give us some funding last year, and I thank these couple people down here, they didn't want the shout out, but from Winthrop University, they have helped us tremendously with the data collection piece to show how effective this is. And just to show you nationally, this is the national data showing you that there is a reduction in substance use for almost every single substance with this program. And we see the same results right now with our York County data. And just heard even better news that we're seeing positive results with decision-making skills and some other skills like that. So we know the program's effective. We're just trying to be able to get every 6th grader so that we can start changing the culture of substance use. Back to you, Janet.
Thank you. I know we're short on time, so I'll fly. But I do want to say, Dr. Neff and Dr. Yang, kudos to you all for helping us make this happen, because we hope that this is something that will be a pilot for the entire state of South Carolina and bring great outcomes to our state. So we are seeing several times a week, unfortunately, where unbeknownst to folks that show up at our door, one medical procedure or surgery led to abuse of prescription opioids, to heroin, to overdose, and we want to catch them before there's actual death there. So it's happening too often, I should say, and we have a Keystone employee sitting there shaking his head going, yep, it's happening more than we want. So obviously it became apparent that we needed to do something as a community. And so we actually put together with York County Island Board, Bob Norwood is here with us, who is executive director of that coalition. We've been working together as a whole community to make this happen. So we formed YC Hope that Dr. Quinn mentioned a little earlier, and of course Keystone's role is to make sure we're focusing on that treatment component. There is there's some research by the National Safety Council that indicates that, of course, combating this opioid crisis takes all of us in the community, every one of us. And so they have 6 indicators that we're looking at matching up South Carolina's progress with other states as well. And so I quickly want to review where we are as a state. Mandatory prescriber education. Now in South Carolina, our physicians have to get 2 hours of education on responsible prescribing to renew their license. I think it needs to be more, but we're getting there. Dr. Keeley. He's smiling back there. Opioid prescribing guidelines. In April of 2017, South Carolina revised the pain management guidelines to include the CDC's prescribing guidelines, so that is progress as well. Eliminating pill mills. One of the things that we talk about in other states is PDMP's prescription drug monitoring program. So in South Carolina, that is called SCRIPS, because we have to have something that is specific to South Carolina. So that is called SCRIPS, and the purpose of that is to identify questionable prescribing and investigations, and doctors actually get report cards that compare them to their peer group to see where they are and where they're matching up. Again, the prescription drug monitoring programs, that is now mandatory for all prescribers, and it actually includes veterinarians and dentists, and I just took my kitty cat to the vet recently because she was having some issues, and I went, wow, gabapentin, okay, I'm going to give this to my cat and not and not take it myself, absolutely. So veterinarians as well. Increase access to naloxone or Narcan, which we've already talked about. In 2016, it is now available without a prescription, and so that's one of the things that we want our patients, the general community, family members to know that they can get that at pharmacies without a prescription, and they can receive the training to administer that. It is very, very simple, and I've got some resources. You can even watch a video on how to do it as well. Availability of treatment. We're talking about medication-assisted treatment, which I'll tell you about again in just a couple of minutes. We've been working with our State Department, DAODAS, for the receipt of both federal and state dollars and private funding and foundation dollars to do what we need to do to expand that in response to this opioid epidemic that we are in right now. This is a picture of what Narcan or naloxone looks like, the nasal spray. This is what our law enforcement officers carry. And again, Sabrina already mentioned this. Narcan kicks off the opioid from that brain receptor site temporarily. And so that's why our law enforcement officers have to carry 2 doses with them, because sometimes there's so much in their system that they stop breathing yet again, and so they have to administer it again. Let me go back. This is Narcan usage by EMS in South Carolina. And I know Sabrina already mentioned this. Just in this map, York County is in the 2nd highest category in South Carolina for naloxone administrations by EMS in South Carolina. And again, remember, we're a border county, so that's not going to be lower than what our true numbers are. EMS administration of Narcan, what we want you to see from 2013 to 2017, South Carolina has seen a 48% increase in Narcan administrations, and that's just EMS numbers there as well. The legislation that's already been mentioned, Good Samaritan Law, that went into effect, and there are some new iterations of that. We'll see how that, actually today was crossover date for legislation, so we'll see where things have, including the marijuana bill. Anyway, I won't go into that. But it provides criminal immunity to a person who calls the police or 911 to assist someone who is in distress, they stop breathing, and it's important that our entire community knows that there is a protection there. So please, if you're in a situation, don't hesitate to call 911, because it could be a call that saves someone's life. Training for a law enforcement officer, I feel like I need to call Chief Watts up here, because he's sitting back there because he actually brought this program to York County. You'll hear it called the Leon program, and there's a lot of information on that slide, but that last bullet there where it talks about numbers of trained officers in South Carolina, the number of agencies and Narcan deployments and lives saved, that number changes, of course, every single day. And so we're trying to get more information out about that. And the last numbers that I saw, York County was number 2 in South Carolina for the highest number of saves by our law enforcement officers. So I say kudos to our law enforcement folks for helping make that happen. Again, the folks who are saved by naloxone, of course, are citizens. Danielle already mentioned law enforcement officers. And our canine, our drug dogs. Inhalation, they can absorb it also through their pads. So we just had a training last Thursday on administration of Narcan at Keystone, because we need to make sure that we have it as well at our agency. And we encourage folks to get that training too. York County, we've already talked about some of these things. We formed York County Hope with this emphasis. We had a press conference. Again, all on board, Operation Medicine drop boxes. That number may be, I'm not sure if that's quite up to date, 4.2 million. I think we're up to 5 now, aren't we, Bob? 4.5 million, very good. Of course, we continue to collect data, because it's important that we keep up with what the numbers are, so we know what's really going on. And of course, Chief Watts, again, helped bring the Leon program here to York County, and continue to have opioid summits just like this, and I'm sure there'll be more to come down the road. What is Keystone doing in the treatment arena? I've got a lot I could say about this, but I know we're short on time. But again, research shows that incorporating medications into the treatment team, where the medical staff, the clinical staff, case managers, peer support folks, all working together as one team, that is having the best impact on treatment outcomes and successful outcomes. What we were seeing at Keystone, especially in 2015 when we first started noticing this, was a huge increase in the number of young adults in the 18 to 28 age range. What we were seeing is folks were showing up for an assessment, maybe making it to their first treatment session, dropping out, overdosing, and we had some deaths. And so it was imperative that Keystone, as an organization, our entire state, and treatment facilities across our entire country took a hard look at our abstinence-only treatment philosophy. We had to ask ourselves, I had to ask myself, because I had to make that mindset change, would I rather see someone die or give them a chance at medication-assisted treatment? And of course, that was an easy answer, but harder to put into reality. It's been a learning process. We keep learning every single day, making sure the infrastructure is in place, the communication between the medical and the clinical team. They know what's going on with that particular patient, because that one time we don't follow up with that patient could be life or death right there. So we first expanded treatment. We created a Journey program. It's an intensive outpatient treatment program for young adults. because that's the demographic that we saw the most at that time. We have since integrated it into all of our outpatient treatment programs and into our inpatient treatment programs as well. And what we're seeing is success. This, Jessica, is one of the reasons why we changed our philosophy. And I'm going to read you a little bit about Jessica because her parents have joined our YC Hope group. They actually named us. And they want to share their story about their daughter Jessica because, as you can see, a beautiful girl that had her whole life ahead of her, 22 years old. So Jessica's parents work and hope that through sharing their story, we as a community can work together because they don't want anyone else to experience the horrific loss of a child. So they work to raise awareness and remind us that no one sets out to become addicted. They want us to learn to recognize symptoms, a lot of the symptoms that Danielle mentioned here for you tonight. They help educate the community and hope that their story will strengthen people to work together. And I'll quote them, and I know they're not here tonight, so it's appropriate that we quote them. Though no one can go back and make a brand new start, anyone can start from now and make a brand new ending. So there is hope. We want folks to know that there is hope out there. Here are some resources for you. I'm going to leave those up here while I close out because we don't want to leave you scared to death tonight without giving you hope that there are answers out there, but it takes all of us, again, working together as a community. We want you to know that substance use disorders, it's a medical issue. It is a treatable disease, and there's science that is out every single day that gives us even more hope and gives us more tools for our toolbox. And so what we want you to know, too, is that when schools and communities properly implement evidence-based prevention programs, the abuse of alcohol and other drugs is significantly impacted that you saw tonight. So these programs help teachers and our community and parents know that they can make a difference. We know that it's very important because we can divert folks from the criminal justice system. We can divert folks out of the emergency rooms from overdose. We can do those types of things. So I do want to thank you for coming tonight and knowing that we can work together to truly make a difference. It's going to take all of us continuing to band together and support one another. So thank you.
I know that we are right at time. I do have one question on a note card that I'd like to honor, and then we'll close out the panel, and the panelists will be next door for the reception, so if you have questions you'd like to ask them, you can certainly engage them there. But the question that I have is actually for Danielle, and it's related to the survey data that you have, and particularly around the question of wording on perception of harm, and are there specific questions for prescription pills versus other types of opiates that maybe aren't prescription?
We have not done that. That may be something we can look at doing in the future, but right now it is just kind of how do you perceive taking a prescription pill other than prescribed. So it is a overall kind of prescription pill, but we do have the ability to add questions in the future, and maybe with this opioid epidemic in the next survey that we do, we can add an opioid specific question.
Okay, great. Well, thank you all for joining us tonight. And again, I hope you'll come next door and have a chat with our participants in our reception.
We can ask Dr. Yang and Dr. Neff to help us with that.
Can I just initial, or do you need my full signature? Full signature. Okay, just in case he doesn't believe you.
Keep it coming.
I told him that you contacted me today, so. And I am looking into the ride-along thing. She forgot to ask, so she's going to ask. She's going to email.